Hello and welcome to the second episode in our series on cerebral palsy. In the first episode, we understood some fundamental information related to cerebral palsy, like its definition, its prevalence, and its classification. In this episode, we will try to understand what are the symptoms of cerebral palsy. Come, let us meet our expert.
Developmental milestones are the normal milestones which are attained by each and every child at a particular age group. These are the normal physical and behavioral changes which we see in the kid. So broadly they can be classified into gross motor, fine motor, language, social, vision and hearing. For example, in gross motor milestone, so a child starts to walk by around 12 to 13 months. That's an example for a gross motor milestone. So fine motor milestones, so if you imagine a child holding a bead between the thumb and the index finger, it's called as a pincer grasp. That is usually attained by around 11 months. The mature pincer grasp is attained around 11 months. So language, child starts cooing by around 8 weeks and starts speaking monosyllables by around 6 to 8 months. And that is how a child starts speaking words by around 15 to 18 months. So that is language. And social milestones is like how the child reciprocates to the external environment and the external people, like social smile, which usually comes by around 2 months of age. Then the child waving bye-bye and giving a flying kiss. All these are various other social milestones which we see in children. So the main symptoms of cerebral palsy depends on the type of cerebral palsy. As I already mentioned, if it's a spastic cerebral palsy, they come to you with excessive stiffness of the limbs. It could be 1 limb, 2 limb, 3 limb or 4 limb, depends on the extent of the injury. If it's a dystonic cerebral palsy, they come with abnormal twisting postures of the body. If it's ataxic cerebral palsy, they may come with gait issues. Apart from this, the main thing which we, as I said, because of the injury to the growing brain, what happens is the developmental milestones will be delayed as compared to their siblings or the peers of the same age group. So they'll come with developmental delay along with the spasticity, dystonia or ataxia. So developmental delay means children are not attaining the milestones age appropriately. As I had mentioned before, a child is not able to hold his head at around 4 to 5 months of age, or not able to sit independently by around 8 months of age, stand independently by around 10 months, not able to walk by around 12 to 13 months of age. These in a gross motor sector. Similarly, we have other milestones which has to be attained for a particular at a particular age in fine motor, language and social. By around 15 to 18 months, child is supposed to speak at least around 5 to 10 words. Child is supposed to speak. So if child is not able to speak, child is not having eye contact, child is lost in their own world, it will again point towards specific disorders. So in cerebral palsy also, we can find these symptoms of developmental delay, that child is not attaining the milestones of that particular age group. So, CP, as I mentioned in the definition itself, is associated with other comorbidities. The most common symptom is speech and hearing issues. They'll have language delay. So they'll not be able to communicate their needs most of the times, and they might depend on gestures, or sometimes they might completely depend on you to communicate their needs. Other most common comorbidities, epilepsy or seizures, which we commonly see because of the injury to the brain, scar in the brain. Lots of children, at least around 40% of the kids with cerebral palsy will have seizures as a accompanying symptom or as a presenting symptom. Apart from epilepsy, they might also have intellectual disability. They might not have a normal IQ as we compare to the peers of their age group. They might be subnormal with a lower IQ, and they might be classified as intellectual disability. And they also can have a lot of sensory issues, tactile issues can be there, and vision and hearing issues also can be noted. Apart from that, they can have musculoskeletal issues because of lack of use of the muscles in the body, proper usage of the muscles. They can have developed contractures, they can have bone deformities, They can also develop osteopenia because of the lack of normal usage of the muscles. And they can also have excessive sialorrhea because they can have feeding and swallowing issues, because of which they can have excessive sialorrhea, means excessive salivation from the body. That would be one of the most common complaint which we see in the children with cerebral palsy. These are the associated non-motor symptoms of cerebral palsy. Parents actually can identify these symptoms by comparing the developmental milestones, which I said, with the elder siblings or peers. By, if they already had a kid, they can actually compare the milestones, so that the child is attaining the milestones, developmental milestones, age appropriately. Is there any change in the tone of the body? Like, is a child is excessively stiff while changing the diaper? Is there any abnormal posture in the child? Or is a child having normal eye contact, is maintaining a social smile is there? Is there any feeding issues in the kid? And is there any excessive fisting of the thumb, especially in the first 5 to 6 months? If they have excessive fisting, then it is also one of the early indicator for evolving cerebral palsy. Are the kids responding to this name call? Are the kids responding to sound in the house other than the name call? Or child is having any other symptoms, like I mentioned, seizures, salivation, or hearing issues, or vision, the child able to fix and follow. All these things you have to keep a watch, and then you'll be able to identify, is a child normal or is there any deviation from the normalcy, which you have to intervene early.
This concludes the second episode in our series on cerebral palsy. In this episode, we understood what are the symptoms of cerebral palsy, what is the meaning of developmental or neurodevelopmental milestones, what is developmental delay, what are the main symptoms of cerebral palsy, what are the other symptoms, and how parents of children with cerebral palsy can actually detect and monitor the symptoms of the disease. We'll be back with our next episode. Namaste.